Hello there. I didn't see you. I was knee-deep in this ophthalmology book. What book am I reading, you said? You might have heard of it. It's a basic and clinical science course glaucoma book. 289 tantalizing pages of ophthalmology pearls that will make you a better ophthalmologist. And this isn't even the only book in the series.
Huh?
And I'm not the only Hamilton Eye Institute faculty member that appreciates it. Let's hear from other familiar faces in the department about what they love about the BCSC.
Are you tired of medical textbooks that look like this?
Yes, sir. Yes, sir.
Do you have a social life that prevents you from memorizing 3,000 pages of Ryan's retina?
Yes, sir. Yes, sir.
If so, forget this. Head straight to BCSC. It's got all the information from there, condensed, shortened, and compacted into just 17 easy-to-read chapters. And if you're doing it right, it'll be all the info you need to do well in your OCAPs and become a board-certified ophthalmologist. Happy studying, you guys.
Hi, residents. It's Dr. Hohen's story time. And today, I'll be reading to you from the Pediatric Ophthalmology and Strabismus section of the BCSC, or the Basic and Clinical Science course from the American Academy of Ophthalmology. Let's see what fun story we can find today. Here's one. Overaction of the inferior oblique muscle is one cause of over-elevation and adduction. It is termed primary when it is not associated with a superior oblique palsy, and is called secondary when it accompanies palsy of the superior oblique muscle or the contralateral superior rectus muscle. The eye is elevated in adduction, both on horizontal movements and in upgaze. One explanation is related to vestibular factors governing postural tonus of the extraocular muscles. Isn't that fascinating? And for more wonderful stories about pediatric ophthalmology and strabismus, you too can read all you want in this fabulous book. I hope you will. Thank you.
University of Tennessee, according to Disaster Hotline, how may I help you? Oh, got it. Multifocal corneal infiltrate in the setting of exposure to organic matter. Sounds like a fungal keratitis. Given the fact that we're in the South, it's probably fusarium, which the only FDA-approved choice is Natacin. No. I promise you can still get the drug. Can I place you on a brief hold for one moment while I answer another call? Thank you. UT Corneal Disaster Hotline, how may I help you? Corneal perforation secondary to infectious keratitis. Gotcha. How large is the perf? Oh, over 3 millimeters. That's likely going to need repair in the operating room according to the BCSC. Is that something that your institution is capable of, like, triaging? No? Okay, all right. I would recommend a transfer. Can I place you on a brief hold while I speak with our team? Thank you. Well, sounds like a lot of information, which all of you can learn in the BCSC.
Huh?
There's one for cornea, lens and cataract, which can explain a lot of the surgical settings, and even one for refractive surgery. Short, easy, quick, and full of knowledge. You just have to read them. Go.
Greetings, everyone. Dr. Westbury here with a plug for the BSCS manuals. As you can see, manual size has changed. This was a 2000 manual. This is a current day manual. The 2000 manual is twice as large as the manual I had in 1982.
Huh?
So you can see the tendency here is to have much more material covered. Part of that is due to scientific advancement in our field, as well as much better understanding of a lot of the complex topics that have come up in ophthalmology. I think the books are a first source for training as residents and as fellows. They can help you earn CME credits, and they can help you prepare for boards. It should be a nice companion for you as you go through the residency. The books are much more comprehensive than they used to be. They cover subjects in much greater detail. The material has been greatly updated, and they include material that really wasn't even part of the manuals in the past. Like, for example, the refractive surgery manual. Many of you will learn a lot about these things haphazardly in our clinic, but if you study the manuals, you can get a lot more detail. It's a convenient source for CME credit, but it's compatible with all that you're going through right now in residency training, and I encourage you to do the reading. I think it'll make you a much better ophthalmologist, and it'll give you a good foundation for future use. Thank you.
So hello everybody. Really here at UT and St. Jude, you really have a very unique exposure to ocular oncology. So be prepared for call, for the boards, for clinics with this, the ophthalmic pathology and intraocular tumors BCSC, which really compiles it all.
Oh great, another 5-page resident neuro-ophthalmology consult checkout. Oh, and here's Ed. Oh hey Ed, I read all about it. Another bilateral hand motion IIH patient, and oh wait, she's pregnant with twins at 32 weeks. What a day. Yep, I'll be right there. I'll let Olivia know she won't see me for the rest of the weekend. All right, we'll see you there. Bye.
Oh, another novel from the residents. Oh, great. Hey, Ed. Yeah, so my GCA patient's now totally blind and also psychotic and throwing feces at people. Great, thanks. We'll be over in a bit.
Neuro-ophthalmology BCSC. Read this so you don't have to live this.
Hello. Ophthalmology resident education has changed a lot from the time that I was a resident. When I was a resident, the basic science course was a skeleton kind of document. It was not as comprehensive as the present basic science course, and you had to read that and then supplement your education with physical textbooks. So we had to buy all of the various textbooks that were recommended that are thought to be the documents of the day that were best. Now, the basic science course is a comprehensive document. If you read it and reread it over and over again, you will master all of the basic science information that you need to pass your OCAP exams for annual assessment as well as later board certification. I encourage you to take advantage of this and make the most of this text.
Mom, can I see that book you're reading?
Oh, this book? This is the American Academy of Ophthalmology's Basic and Clinical Science Review course, and it's Section 5 on neuro-ophthalmology.
I never knew that optic glioma is the most common primary tumor in the optic nerve.
Yeah, there's really interesting information in this book, and I read it when I was in ophthalmology residency.
When's a good time for me to start reading this?
Well, a really good time to start reading it is when you're an ophthalmology resident, like this guy.
Bro, these books are so amazing. Even a 9-year-old can read it. Or an 8-year-old.
Hello, experiential learners who are also known as residents at the Hamilton Eye Institute. Dr. Claire Wright has asked that I inform you about why I think the Basic Science series, especially the one about pediatric ophthalmology, is so important and such a fabulous thing. There is one thing I can tell you about the BSCS. It's the answer book. You will have to take the boards one of these days. People will ask you apparently obscure questions. The thing is, they have to be in that book. So it's the answer book. Doesn't matter what the question is. If you know what's in the book, you know what the answer is. And that's going to be an important thing. The other thing is, it helps you create a framework. Your independent study of the basic science, I know this is supposed to be cute and funny, but this is serious. It creates a framework for you to hang the things that you then learn as you see patients and as you care for patients. If you don't know the framework, especially for pediatric ophthalmology and strabismus, which is so conceptual, where you have development going on, and then you have two eyeballs that got to work together, and a visual cortex that's got to be integrated, and all the other refractive effects on strabismus and amblyopia and all that stuff. You got to have a framework to hang all the information that you can then use to at least not look like a fool when you're on pediatric ophthalmology and do good things for the little kids who are depending on you. And it's the answer book. If I could give you any advice, it would be get through BSCS, familiarize yourself with all the topics in your first year. In your second year, when you're on individual rotations, get out a classic text. Like when you're on glaucoma, review that classic text. When you're on peds, do the Wright. And then, in your third year, you can review again for boards. That's my suggestion.
Studying this BCSC stuff is so hard sometimes. I feel like I can barely do it. Why can't I just ask Siri when I don't know something? Let me see. I bet Siri will know. Let me see. Dear Siri internet thing, why can't I just ask you a question when I don't know something as an ophthalmologist?
Chance favors the prepared mind.
Oh, come on. All I want to do is watch TikTok videos and do some injections and do cataract surgery. Why do I have to study this stuff? It is so hard. I know what. I'll ask the ChatGPT internet body thing. Let me see. Okay, I know how to do this. All right. Dear internet ChatGPT body thing, why can't I just ask you a question whenever I don't know something?
Chance favors the prepared mind. You don't want to be an NPC.
Oh gosh, I guess I really do have to study it.
Hey, this is Connie Fry, and I want you to know we've got that Dr. Fry challenge for OCAPs going. I know that each and every one of you is smart and that you can do this. I was a PD for over 6 years, and I've worked in resident education for over 25, and every one of you is smart. I've met you all, I've worked with you all can do this. And so the Dr. Fry challenge is that I think each and every one of you can hit at least the 50th percentile on the OCAPs. It's going to take some work, but I know that you all can do it. So who wants to sign up for the Dr. Fry challenge? Okay, so what's it going to take? It's going to take a couple of things. One, dedication. You've got to read the books, and then you've got to process the information, and you've got to learn it, right? And so what happened? You're a first-year resident, you're reading through the books, and it's going in one ear and it's going out the other. That's okay. Keep doing it. By October, you're going to feel like you know nothing and it's pointless. Don't go there. Everybody I've known in every program across the country, whether it's Jules Stein, whether it was back in San Antonio, they all said the same thing. By October, they couldn't figure out what was up and what was down. But when it starts to sink is about in January. And that's what you want to do, is have it start sinking around mid-January, and then February really gelling, and you can hit at least the 50th percentile. So how do you do it? You take and you study consistently every week. What it's going to take is about an hour from Monday through Thursday, every night or every morning. You pick what works for you. And then 4 hours each Saturday and Sunday. Now, do you have to split it up like this? No, but it's about 12 hours per week that you have to consistently study week in and week out to get it done. How do you study? You just read the books till they're mind-numbing? Imagine reading fundamentals. That's the best cure for insomnia. It's not going to work. See, what you have to do is look at a disease process. So I have one disease process I've picked out, and it's orbital vascular malformations. It's in Orbit book, it's in pathology book, it's in our favorite fundamentals, and it's in pediatric ophthalmology. So if you go through each of those books and sit down and learn orbital vascular malformations and go through each one, it's going to start to make more sense. And so I challenge you to do this with each disease process, whether it's glaucoma and looking at the With glaucoma, you'd be looking at path, glaucoma, and fundamentals. And the fundamentals part of that's relevant to glaucoma is like the drugs, right? So this really helps. So with orbital vascular malformations, you've got some nifty pictures, some MRI scans. In the regular book, in pathology, you're going to have all the pictures. See these large blood-filled spaces? What's that? You know? And then here we've got a great picture of a cavernous hemangioma. And so you can start looking at these pictures and backing towards orbit and seeing how these interrelate. Then you go to fundamentals and you pull in the anatomy and you look where the blood vessels are and how that's relevant. And finally you go to pediatrics, because some of these are disease processes of kids, not just adults, and how that relates to things like amblyopia. So I know you guys can do it. So I'm looking forward to seeing great scores next year on OCAPS.
Hey guys, have you ever wondered why so many people from HEI go into oculoplastics?
Of course, it's the breadth and the creativity of the field.
Obviously, there was spark on me.
But do you know the real reason why?
It must be the Tyrone effect.
The Tyrone effect. It's definitely the Tyrone effect.
The Tyrone effect.
Is there any other reason why? The Tyrone effect.
Go.
Reading all the BCSC books changed my life.
My name is Dr. Cynthia Noguera, and I am an oculoplastic surgeon at LSU Health Shreveport.
So if you want to have a glow up like Dr. Fowler, read the BCSC. Be cool. Super cool. Oh my gosh, are you Dr. Fowler?
I am. Make sure you study.
Well, there you have it. So many good reasons to read your BCSC. So what are you waiting for? Go ahead and get into it. Your OCAP scores will thank you.